I started my career in Italy, and I studied nutrition. So while I was studying my first degree in Italy, I really became interested in understanding how nutrition can affect health, and more specifically, maybe a more cellular, molecular level. So then I came to this country, and I started my career at the Rowett Research Institute here in Aberdeen, and I was interested in looking at the micronutrient selenium, which is an antioxidant which helps protecting the body from oxidative stress, and to understand how this very small micronutrient affects health in general. So my career then developed, and I arrived at RGU, and it's where I developed my own area of research, looking more in details at the mechanism and of how this small nutrient can affect diseases. In particular, I am interested in what's associated to obesity and associated diseases like cancer or non-alcoholic fatty liver disease. So more recently, we are looking of how selenium, how selenium can affect the crosstalk between the adipose tissue and colon, the intestine. So a few years ago, we've shown that the amount of selenium in the body can affect the incidence of colorectal cancer. So now we are more interested in understanding how does this small micronutrient can affect this crosstalk, because we know that obese individuals are more susceptible to colorectal cancer. So can we intervene? And interestingly enough, in this era of where we think that malnutrition is not there anymore, we have a paradox, because we have overnutrition and malnutrition, where now we refer to malnutrition as micronutrient deficiency. So where even if we're taking a diet and a lot of calories in some cases, we are missing some of this small micronutrient. And that's where I'm focusing, and where I will focus, trying to challenge all of you in the curious mind and show you that small nutrients are very important for your health. I will put on the table the concept of hidden hunger, which is, as I mentioned, the deficiency in our diet of some very important nutrients. And I will try to challenge you in showing that it's important that we take a varied diet, that we have a varied diet, and that our intake of small amount of nutrients are very important. And I can show you that it's been linked, this hidden hunger, with the outcome of COVID-19. Some patients have been more susceptible to the side effects of COVID if they have this kind of hidden hunger or malnutrition.